Now coming to the development of interatrial septum. That is the septum in between the right atrium and the left atrium. This one. It is formed by the septum intermedium, this grey color, plus, somewhat like plus sign, and this is septum primum and this is septum secundum. Okay, and also this is septum spurium and this is right sinus valve and this is left sinus valve. Left sinus valve and septum spurium, they will reabsorb within the septum secundum. So septum secundum as a whole, septum primum, some part of the septum intermedium, this will result into the interatrial septum. First we will look into the heart tube, in which this is the sinoatrial orifice in between the sinus venosus and the atrium, primitive atrium. Okay, this is the sinoatrial orifice which will convert into the right and the left sinus valve, and here it is attached with the roof of the atrium, right atrium, by the septum spurium. Now this story begins with the development of, at first initial stage, only there is one septum, just like what we are seeing here. One septum is coming down from the roof of the atrium, common atrium. From the roof, there is one septum is coming down towards the septum intermedium. This is first forming septum, that's why this is known as septum primum. But it do not go up to the septum intermedium. There is some defect. Do not go up to the septum intermedium. This defect is called, or your opening is called ostium primum. As this is first opening, this is called ostium primum, and this septum is first formed septum, so this is called septum primum. Now with the time it closes. It closes, there is no opening. We know that in the intrauterine life, the blood comes from the right atrium to the left atrium. Blood flows because right atrium to right ventricle, and then from the pulmonary trunk going to the lung, but the lung is not working, so there is no way out from here. So blood has to take this path from right atrium to left atrium. But this septum closes with the time. This this opening is closes by the time. So somehow there has to be a second opening so that the blood flow from the right atrium to the left atrium. So there is programmed cell death in the upper part of the septum primum. This is called ostium secundum, as this is the secondary formed opening. That's why this is known as ostium secundum. Okay, ostium secundum. Now what happened? And another septum from the roof of the atrium, just right side of the septum primum, from the roof, one septum again begin to form. This is known as septum secundum. It is somewhat rigid, and septum primum is somewhat flappy, and it is rigid. It again come downward towards the septum intermedium, but it is not so. It's only intention is to override this opening. Override this opening. That is the ostium secundum. Okay. Now it stops. It stops here as soon as it just overlap this opening. Septum secundum. Now blood has to take an oblique course. First blood going from there, when it closes ostium primum, then ostium secundum come. Then blood flows from here to here. But with the development of septum secundum, blood has to come from first below, then above, in between these two septum, and then going into the left atrium. So now this opening now renamed as foramen ovale. Okay. And this septum secundum later on, it also involve the left sinus valve and the septum spurium. Both will get reabsorbed into the septum secundum. And this is after the oblique course, this is renamed as foramen ovale. And after birth, when lung become functional, then through the pulmonary vein, now blood is coming into the left atrium and the pressure inside the left atrium increases. So as this is flappy valve, this will approximate. This will, due to the rise pressure, this will approximate with the septum secundum. Now if we look into the chamber of the right atrium, then what we see, there is one fossa created over after birth, after the approximation of septum primum, due to its flappiness, due to the rise pressure, it get approximated and later on fused. But there is a depression over here. This is known as fossa ovalis. And this margin of septum secundum is remain as the margin of the upper margin of the fossa ovalis, and now this is known as limbus fossa ovalis, which is nothing but the lower margin of septum secundum. Okay. Now come to the if there is defect, if there is not the normal pathway, what will happen if there is some defect? First defect is the defect of ostium primum. This will close by the time. What we have read? This will, septum primum will approximate with the septum intermedium and this opening is closed. But in some case it remains patent. So this case is now known as interatrial defect of ostium primum. Okay. One case is also such like that the septum secundum do not overlap this ostium secundum. It just stop before the ostium secundum. And now this defect is called defect of ostium secundum of interatrial septum. It was not overridden or overlapped by the septum secundum. Okay. Now another case is when interatrial septum rises after birth. As this is flappy, the septum primum will approximate with the septum secundum. But in some case, and later on fusion occur. But in some case, it will approximate but don't get fused. This is known as patent foramen ovale. Actually, this will work. This pathway will work. Not totally approximation occur, a little bit approximation, but this pathway will work. And this is known as patent foramen ovale. But in few cases, the approximation occur almost completely, so that the blood do not flow from the right atrium into the left atrium. Close approximation occur. This is known as propatency. As the blood do not flow from the right atrium into the left atrium. But if we put a probe, then it will easily pass through it. So, this is known as propatency of foramen ovale. Okay. And what is patent foramen ovale? When there is not the fusion of, after the interatrial pressure rises, both will not get fused, and even though not closely approximated. So foramen ovale remain patent, and that is known as patent foramen ovale. Okay. And propatency I have already discussed. So these are the complication if the normal development of interatrial septum will not occur.